Welcome. I'm Rogers Anderson, Williamson County's mayor. And this morning, today, we have a conversation with a doctor from the Vanderbilt Allergy. I don't know what it's exactly called, but thank you, Dr. Cosby, C-O-S-B-Y, being with us today.
Yes. So I'm coming from Vanderbilt Asthma, Sinus, and Allergy and program there on West End Avenue, and I'm also coming to represent allergy research that we do at Vanderbilt. So.
Well, I'm your perfect candidate this morning.
It sounds like it.
The allergies have caught up with me. I was telling someone in the elevators, we got down to the studio, my car was just absolutely covered this morning.
These are the green card days. These are the days when everybody just says, this is awful, I can't stand it. Yeah.
So let's talk a little bit about you, the individual.
Sure.
Before we went on the air, you indicated that you're from up in the Crossville, Cookville area, up in that area.
Right.
Really Cookville, I guess.
Yeah, no, Crossville.
Crossville.
Yeah, I grew up just south of Crossville in the Homesteads, and went there for high school, and ended up in Nashville for college, which is where I met my wife, and then did my medical training and public health training down in Birmingham, Alabama. And then from there, we lived abroad in Africa for a year, came back and went up to Connecticut for my residency, and then came back to Nashville to be close to home again.
Family?
Family, yep. Family have two girls, 5 and 2, and we're having a good time, keeping me busy.
That's kind of why he looks like he's more awake than I am. Two small children. You're up and at them early in the morning.
I tell you what, though, any day I have to get up early, they sleep in, and vice versa. So any day that I could sleep in, they get up early.
So we want to spend our time, because it is the allergy season.
Yes.
The pollens are out in the air and causing a lot of us havoc. We could talk about air, we could talk about skin, we could talk about the ticks, the tick bites, what they present for us, the issues they present. So I'm gonna let you first. Let's just talk about this time of the season and the pollen.
Yeah, pollen. So right now is tree pollen season. Spring is tree pollen season. All that yellow that you're seeing on your cars, that's the trees waking up and trying to find each other and make little tree babies. And so they are vigorously producing pollen, and I think that we have the potential for, at least an average, if not, stronger than average pollen season, just because of all the wet that we've had. It's been so rainy, and the trees are therefore going to wake up, when it's warm, and they're going to have access to a lot of water. In a dry spring, we're not going to have as much pollen, but I think that this year has the potential to be pretty bad. Tennessee is really biodiverse. We have trees and grasses that come from, they can tolerate growing in the north, and we've got things that can tolerate growing, even further south. And if you head up, even closer to where I grew up, that's considered to be one of the most biodiverse subtropical, forest climates in the world. And so heading up towards Knoxville, it gets even more, we just got lots and lots of different kinds of trees and grasses and things that people can have allergy to.
When we talk about the pollen, oftentimes on the radio or television, they'll give us a pollen count.
Right.
And they'll particularly talk about maybe a particular tree that's emitting and causing all of these issues with us. Is there a standard that all of us need to be aware that have allergies or have these symptoms of that we need to be cognitive of, or is it just this time of the year? It's
just this time of the year, and I think that every patient with allergies is going to be different than the next patient with allergies. In the same way, every person's environment is going to be a little bit different than everybody else's. So the most common thing that we find is that people are allergic to things that are in their environment. And so it's not necessarily the case that every tree that's blooming is the one that you're allergic to. Now, pollens can irritate the nose, and they can cause the nose to run and to drip and to feel raw, even if you aren't actually allergic to it. So some people have nasal symptoms in pollen season, even without being allergic to that pollen. But the person who wakes up and their eyes are red and they're itchy and their nose is itchy and it's dripping and they're coughing and they're just miserable, that sounds a lot more like allergies. The itch is one of the things that helps us really know. Now, if I were to go and test you and test your neighbor, and you both had allergies, the likelihood is that maybe you are allergic to the same things. But if I was going to test you and test somebody on the other side of Franklin or Nashville, you might be allergic to different things because you have a different microenvironment, where your trees that are nearby are different. If you have, let's say, a maple tree, or an oak tree, and, your neighbor doesn't, that oak tree, when it wakes up and it starts making pollen, it makes a bloom of pollen that can go for, multiple acres and multiple miles. But if you're somebody on the other side of that sphere, of pollen that's being released, that halo, you might not experience the symptoms from that particular tree.
So how does one tackle these issues of getting some relief? I know you can go down to the local drugstore.
That's right.
That's one certainly, I'd say a lot of people do that.
Yeah.
And the more severe cases, or people, not necessarily severe cases, but people will invest their time and energy in going to Vanderbilt.
Or get allergy shots or something like that. So I think that it's never too early to figure out what it is that you're allergic to. If you're having trouble and like I'm just so itchy and miserable, it's never too early to figure out, well, what is it that's in my environment that's making me have those symptoms? And that's a test, that your allergy doctor, your local one, can provide you with, a skin test, and sometimes a blood test. A lot of people will spend a lot of money chasing their symptoms without knowing for sure whether they have allergies, and that's not necessarily wrong. If you're lucky enough to find the right thing, from the over-the-counter drugstore, right off the bat, then that's wonderful, and I'm perfectly content with that. But if you're somebody who's been chasing their symptoms for a while with different over-the-counters, then you might be somebody who would benefit from just taking a step back and saying, well, what is it that's really causing my symptoms? Is it allergies, and which allergies are they, and should I go get some more specific advice? Now, as far as over-the-counters medications, there's some great things that you can try. So I typically have patients who feel, very confident that they have allergy symptoms, start with those over-the-counter antihistamine tablets that are not drowsy. In the old days, everybody used to say, well, I've been taking Benadryl, and so I'm just, kind of slightly out of my head because of the Benadryl making me sleepy. And the generic name of Benadryl is diphenhydramine. In between, when we're talking, a generic is just as good as a brand name if it's coming from over the counter. So don't necessarily have to spend the big bucks on the brand name. But the ones that I'm thinking of, there are 3 that are non-drowsy, and they all work fine. But they do have, actually one head-to-head study that showed which one is the strongest and which one is the weakest. So going from strongest to weakest, the over-the-counter that's the strongest is the Zyrtec. That's called cetirizine. So again, generic's just as good as the brand name. 15% of people, though, will get sleepy on the Zyrtec, or get a headache or something. It's just a little bit more drying. It's a little stronger. The next one that's not drowsy and seems to not cause as many symptoms, but not quite as strong, is Allegra, also known as Fexofenadine. And then the third one is the Claritin, also known as the Loratadine. There's a fourth one called Zyzal, and it probably fits somewhere in that spectrum, again, over the counter. So those tablets, you take them, and they aren't going to work right away, but over the course of 2 or 3 days of taking them, you'll notice that you're less itchy and that you're probably making less mucus in your nose, less running. So if that's enough, then that's great. And you can take that through your allergy season. I typically say that if you're a tree allergic person, you want to start taking that tablet at Valentine's Day before the trees, before they wake up, because they're going to wake up earlier than you think, and you're going to start suffering earlier than you think. And then take that one through, kind of the middle of the summer. If you're a grass pollen allergic person, you're going to want to start taking that in the spring, and you're going to want to take it through the fall. If you're a ragweed or a weed allergic person who's a fall person, you're going to want to start taking it in the summer and take it until the first frost. So those are just sort of general guidelines for when to take those tablets. Now, beyond that, there's, the next thing that I tell people to try is nasal steroid sprays. Nasal steroid sprays are over-the-counter. There's different ones. There's, Flonase and its generic fluticasone. There's Nasacort and its generic, which is triamcinolone, and then there's others. Those are really easy. Those are really beneficial for nasal swelling, and that's what I tell people if their nose is just so swollen that they can't really even breathe at night. And the trick with those is that you think that all you have to do is shove it in your nose and squirt. But that's actually going to waste the medicine, because most of that medicine is going to go straight through the back of your nose and down your throat. And if you tasted it, you wasted it. So what I tell people is kind of lean forward, put it in your nose, and then aim it outward like you're going towards your, the top of your ear, like this, outward. Because, the tissues where people are getting swollen are over here in the outer portion of their nose. And so you want to try to hit the bullseye and not miss the mark. And if you're squirting it in the middle of your nose, the other thing that can happen is that you can land on your nasal septum, which is right in the middle, and that's where your nosebleeds come from with nasal sprays. So, these are just some helpful tips. The other thing that I always tell people, is helpful is washing your nose out with saline. You can get one of those neti pots. You can get one of those squirt bottles. They have these little canisters that will spray saline in your nose. But the benefit of that is that if you've been out playing in the pollen and you come in and you know that you're going to start swelling up and itching, washing that pollen off will save you some suffering. And washing that pollen out will save you some suffering. So the trick with the neti pot and the nasal spray or the nasal squirt bottles is that you want to be leaning forward over your sink, head down, because the last thing you want is to squirt that thing so hard that it goes down your throat and makes you choke. You'll never want to do it again. But if you're leaning forward and you're in the right position, you're aiming into this nose so that some of it will come out of the other side of your nostril. That will wash all those pollens and pollutants and everything that you've been inhaling out of your nose without making you choke and feel like you're drowning. And it's actually, people feel like it's going to be a terrible experience, but if you have the saline balance just right, it actually feels really nice.
Very interesting and very informative. As I said here, I probably made a bunch of those mistakes that you talked about.
And I think it takes, there's just as much technique as there is knowing which is the right thing to take. You have to know which is the right thing to take, but also how to use it. And unfortunately, on the backs of the packages, there's just a dizzying array of stuff at the pharmacy, and there's not a great amount of instructions as to how to do it the right way.
I would like to ask the question more for the grass pollen people that are watching this show.
Yeah.
Many of us still mow our yards and like to get into our gardens and our flower gardens and our vegetable gardens.
Me too.
Very relaxing.
Yeah.
Kind of get away from the phone, get away from people.
That's right.
You see people sometimes wearing the mask.
Yeah, and it does help because the pollens they tend to be fairly big. They can run the gamut, and you can't necessarily keep all of them out with a mask, but a paper mask will stop a lot of the pollens from getting in your nose. I definitely, for patients who are comfortable doing that, and it provides them some benefit, I definitely say that that's fine to do.
Do we, as we get older, apparently not, get some immunity to some pollens?
Yeah, that's interesting. So I just had been asked to talk about adult onset allergies with folks. So there are certain people who are less likely to ever get allergies, these fortunate people. Turns out, if you grew up on a farm with animals and you spent time with the animals, you're about 20% less likely to ever get allergies. If you're somebody who made it all the way through childhood without getting allergies, you're less likely for your whole life to ever get them. And what we think that represents is that those people have an immune system that has been trained to focus on the right things. When you're taking care of the animals, your immune system's getting exposed to lots of bacteria, and we think that trains the immune system to focus on things that can actually cause infections. Plus, there's a lot of bacteria that we carry around on our bodies that actually teach our immune system to be tolerant of allergies. The allergy immune system is in our body because in the old days we used to walk around barefoot and get hookworm. And we'd get these other parasites that would penetrate our skin, and then they'd crawl through our bodies, and then they'd end up in our intestines and make us sick. And the reason that we have all these terrible symptoms with allergies is because the cells that fight parasites are full of toxic chemicals, including histamine, and what they are designed to do is, as that parasite that's the size of a battleship is moving through our body, in comparison with a white blood cell that's just tiny, they're supposed to blow up like a mine, blow a hole in the side of that battleship-sized parasite. And so those chemicals, histamine, it dilates your blood vessels and it makes fluid leak into your tissues. So you get swollen and you get miserable. And then some of these other chemicals, make you itch, and some of these other chemicals, make you feel, just drowsy and blah. especially to the degree that you're allergic. So we don't have parasites anymore. We've got good water sanitation. I know that you guys provide good water sanitation for the people of Franklin. We don't really walk around barefoot, getting parasites. And so for some people, what happens is that, the immune system, that they have would have been a really good immune system for killing off parasites. It would have been really strong. They would have done a good job killing off parasites. But now in the absence of parasites, those soldiers are just sitting around, and they're getting a little rowdy because they haven't ever had any combat experience. And so then when they see something that looks to them like a parasite, they go after it and they start blowing it up. Well, it turns out it's pollen, because some of the enzymes on a pollen can resemble the enzymes on a parasite. Or some of the proteins that are on there resemble something that they would have seen in actual combat. So they get rowdy and they start shooting civilians on shore leave, and and then the rest is the symptoms that you experience.
Interesting.
Yeah.
As a boy, I did grow up in an ag environment, and I don't ever remember having pollen issues until I probably hit 50 years of age. But now we were hauling hay, working in tobacco, around all of the livestock you're talking about, and I just do not remember. Even when I was in the military, I had the opportunity to serve in third world countries for over 2.5 years, and you would see guys that were just miserable, and I would think, how did they get that way?
Right.
And I'm sure it's a different environment, different pollens that you have in the different countries, but it seems like about age 50 they kicked in, and they kicked in good. I think they're making up time.
That's right. And some people do get allergies in adulthood, and so the question is, it's a mysterious one that we still want to answer, which is why did that person get it later in life? What changed? And partly we know that the immune system changes over time. And partly we know that the environment changes over time. So there's different groups of people who get allergies later in life. One is somebody who moves to a new environment. Let's say that somebody who's been living in California moves to Franklin for the good life, getting away from LA, and they show up here and they haven't been exposed to Tennessee. You're more likely to get an allergy later in life because you're not tolerant of the things that we have here in Tennessee. The strangest one is somebody who's tolerated eating shrimp their whole life, and then they suddenly have a severe allergic reaction to shrimp. As an adult. We don't know why that happens. We do know that for some people, it's because their skin has gotten broken down and dry. And, for the same reason that we talked about, the immune system in your skin is designed to fight off parasites, because the parasites often come through the skin. We don't have parasites. But if your skin is broken down and damaged, it's kind of like a castle wall that's gotten damaged. So if you can imagine that the cells in your immune system are soldiers, they're going to freak out about the fact that their castle wall is broken. So they're going to line up under the castle wall, and they're ready to go. Because any moment now, the barbarians are coming because the wall is broken down. They're going to take advantage of us. And so then when that pollen lands on your damaged, injured, dry skin, we suspect that it makes you more likely to develop an allergy to it. So taking good care of your skin is another thing that seems to prevent allergies.
I've often heard that taking a shower at night helps to get the pollen washed out of your hair so that you get under the pillows. Accurate?
Yeah, that's something that we do recommend to folks. Now, the opposite seems to be true for folks who have dust mite allergy, because the main place you're going to encounter dust mite is when you're laying down on your pillow. The dust mites are living in our mattresses and our pillows. I don't want to gross anybody out, but this is just sort of reality. And they're eating our skin, that falls off of us. They're kind of our little cleanup crew. And so folks who have dust mite allergy often benefit from showering in the morning to get everything, washed out.
Cotton sheets versus...
Yeah, it doesn't make a difference what sheets, but you can get these encasements now, and they actually aren't, a lot of people think of encasements and it's like, they imagine something that's really crinkly and uncomfortable, but they've gotten to where they have these nice woven microfiber encasements that have pore sizes that are so small that a dust mite can't crawl through them and live in your mattress or your pillows. So you can get those, and they have to zip all the way around your pillow, and they have to zip all the way around your mattress. And oftentimes it's kind of like wiggling into your skinny jeans, to get that thing on there. But if it zips all the way around, then you know that, and it's got a pore size of less than 2 microns. It'll say that on the package. Then you know that a dust mite can't get in there, and that a dust mite won't be
sleeping with you.
Yeah, sleeping with you and putting allergens in your breathing area.
Because I know we're beginning to run through some of our time, and I do want to get into one of the things that people oftentimes are very fearful of, and that's tick bites.
That's right. Yeah.
And let's have a little discussion about that, because this area is, I don't know that it's worse than some other areas, but we have our share of ticks.
We do.
Some are worse than others.
We do, yep. And I think that one of the ticks that we pay attention to because of what it can do is one called the Lone Star tick. And it's not because it's from Texas and speaking with a southern drawl, it's because it has one single white dot on the back of it. That one does seem to carry a good variety of diseases. You know, the dog tick around here doesn't necessarily do it. That's the big brown one. But the Lone Star tick is kind of a stinker because sometimes it can carry bacterial infections. We don't actually have, you know, what's classically called Lyme disease. You know, that, I train in Connecticut, where Lyme, Connecticut is, and they have Lyme disease, you know, but we do have bacteria that are sort of like Lyme disease without, hopefully, the long-term consequences. You know, but those bacteria can live in the belly of a tick, and then when a tick bites you, you can get an infection. So avoiding tick bites for infections is one thing. The other thing is that when that Lone Star tick bites you, sometimes it will have just fed on a deer or a cow, and it might have a little bit of that blood. And if you're an allergic person, it seems like that tick sometimes can make you allergic to a sugar that's on the surface of the animal blood. For you and I, there's these different blood group antigens. One's called the A blood group, and the B blood group, and the O blood group, right? So animals that are not humans have a different blood group, and it's called alpha-gal. And you know, so when that tick bites you, it can put that protein, or that sugar rather, into your skin. And so then some people can become allergic to red meat as a result of that tick bite. It's the craziest science fiction story that anybody's ever come up with, but it turns out to be true. And so, you know, the annoying thing about that is that then people will start having reactions and they don't necessarily know what it's from, because it's not like a peanut allergy or a shellfish allergy. You know, if you've seen those in the movies, like the movie Hitch with Will Smith, the reaction is pretty immediate, you know. But for patients who have alpha-gal, it's 4 to 6 hours after they got that tick bite. They'll start having hives and itching in the palms of their hands, and the bottom of their feet will be itchy. They'll turn red and flushed, and then they'll have, you know, a lot of stomach upset. And for people who really have it, you know, then they'll have, you know, shock, or they'll pass out, or they'll break out in hives all over their body. So that's pretty miserable, and it's tricky because the meat has to go through your digestive system and hit your intestines before something about your digestion releases it into your body. And so those patients, if they keep getting more and more tick bites, they can become allergic to not only red meat, but also to dairy and gelatin, and sometimes to medicines. So we do research on medication allergies at Vanderbilt. We do research on food allergies at Vanderbilt. Alpha-gal is one of these weird allergies, you know, that caused by the tick that can make you allergic to both food and to medicine. You know, so it's a bizarre little thing. So plenty of reasons to avoid getting tick bites.
So what are some of the preventive ways to avoid getting bit by them?
One thing is, if you know that there's a lot of deer, don't go stomping around in the brush. The other thing is that there are sprays, camping sprays, that you can get, you know, permethrin sprays that you can apply to your outdoor clothing. You know, you spray it on the clothes, you leave them on a line outside overnight to dry, and then it's good for 5 washings, and it will repel and kill ticks. So that's a couple of good measures. The other thing is that if you're somebody who's maintaining a farm, you know, then keeping the brush down is a good way to keep the ticks down. Because if there's nowhere for the deer to hide, then the ticks won't be accumulating in the
True or false?
brush.
Cedar, pine trees, areas for more ticks than not. Is it the tree, or is it?
It's the fact that it's a good hiding spot.
I figured.
Yeah, it's the fact that it's a good hiding spot for a deer. So the ticks are going to go where the food is.
Rocky Mountain spotty fever.
Yeah, that's a bacteria that's caused, you know, that hangs around in the ticks. You know, it's a specific species called a rickettsia, and you know, it can cause sometimes a bullseye rash like Lyme disease that people think is Lyme disease, you know, but then it will progress to having like a more disseminated fever, and you know, people feel awful. And we aren't in the Rocky Mountains, so again, that's annoying. Somebody named it Rocky Mountain spotted fever, but it actually is more likely to happen to us. So.
We've got about 3 minutes left,
Sure.
and as normally, I've overlooked something that maybe that you'd like to get out,
I don't
the
think so.
message that would get out. We do need to give a plug for Vanderbilt because they've let
Oh,
you
yeah.
come down today. I
Thank you.
assume that they write your check and
They
got
do.
the name on it.
They do, yeah, and I think, we're always looking for partners in the community who want to support allergy research. The thing that we've got going right now is we have the opportunity to build a food allergy center, and what that doesn't mean building a new building. It just means providing support for folks who are going to be doing research in food allergy, and that's been something that's long been missing from our community. But it often takes grant funding to get this kind of thing started. So if there's people who are interested in supporting allergy research who've suffered from it, then talking to our faculty or to our development office at the medical center is a way that you can help us grow in order to meet the needs of the community. So that's the one pitch that I'll make. The one thing that we didn't talk about that I think is probably the most crucial topic for parents is how do you prevent your child from getting allergies? And it turns out that there are several ways that you can do that. One that we know has a strong evidence base is that when your baby is born, your beautiful baby, all you think about is, oh my goodness, this baby's so perfect. I just want to keep them clean and smelling nice and just have that nice new baby smell for as long as possible. Turns out you don't have to wash them with soap all the time, because they still have the new baby smell even if you don't wash them. And the more you wash them, the more likely they are to get eczema, and then that broken down skin problem that we talked about comes into play, which is that if they've got broken down eczema skin, they're more likely to get food allergies. Peanut dust might land on their skin when they're a baby. So we think, that one of the best things that has come out of the research in the last 10 years is that when you bathe your baby, and I really just say bathe your baby whenever they're stinky or dirty. They've got poop on them. Clearly you can actually see the dirt, smell the dirt.
Right.
Just wash them with water. If you need a little soap in the diaper area, that's fine. But after you bathe them, put Vaseline on. And Vaseline keeps that skin from breaking down, and it prevents eczema in 50% of the kids. And you can prevent 80% of peanut allergies by introducing peanut early into the baby's diet. So what that looks like is that when they're about 4 to 6 months old, if they don't have eczema, you just get some peanut butter and you mix it with some hot water and you kind of dilute it down. If you're worried about it, talk to your doctor in advance, because there are a couple of groups of people that we say don't introduce peanut butter early. And it's kids who already have really bad eczema, really bad allergic skin, or they've already got another food allergy like an egg allergy or a milk allergy. So if your baby falls into that group and you're trying to prevent a peanut allergy, come talk to us at the allergy clinic. But we can prevent 80% of peanut allergies by introducing peanuts early to a baby. So
lots of information you've covered this morning. Thank you for being with us.
Oh, my pleasure.
Very informative. Maybe we can have you back as the season goes on.
I would love that.
We appreciate what you do for our community, and thank you to Vanderbilt for the research they're doing. Yeah. I'm Rogers Anderson, Williamson County's mayor. We'll see you around the next time. Have a good day.
Spring Rain by Louise Strang. Spotlights of sunshine sweep through animated clouds, fluffing along in high-spirited tempo, rising on unseen currents. Suddenly, a symphony descends, musical showers with sprinkles of flutes, shadowed by timpani until thunder cracks the shell of beauty and rouses life to wake. A chorus of birds replies as the last drops of rain fall, like syncopated dancing taps lightly on a triangle.